stop coronavirus. Hello everyone, myself Komal Nanar, the student of Bharati Vidyapeeth College of Nursing Pune and the NSS volunteer. Today I am here on a small topic of COVID-19. As we all aware about the present scenario of coronavirus, where the first case was reported in Yuan, China in 2019, which is declared by WHO, where the COVID-19 is a pandemic disease where the worldwide population is hampered. I am going to deal with the what is coronavirus, how it spreads, risk group, sign and symptoms, how it can be diagnosed, and precautions. COVID-19 coronavirus. It is a most infectious disease which is recently discovered by a new coronavirus, that is novel coronavirus, where it belongs to a large family group of viruses such as MERS and SARS, where it is in pandemic disease. How it spreads? It spreads from the person to person by droplet infection in the form of cough and sneezing. The risk group which can belongs to this coronavirus is the elderly people is more than 65 years age, infants, low immunity power individuals, and the comorbidities such as diabetes, hypertension, and any form of cancers present in the human being. Next is what is the sign and symptoms seen in COVID-19 patients. First is fever, as the fever says that if there is in presence of infection, it abrogates the fever. Next is cough, sore throat, difficulty in breathing, and shortness of breath. If this symptoms is not treated, it may further lead to pneumonia and many much complications. Next is how we can diagnose this COVID. It is diagnosed with the help of history taking of any international travels of the individual, and in the form of CDC. The CDC has given a 3 specimen collection, that is upper respiratory, lower respiratory, and blood specimen. And for further diagnosis, PCR test is done. The most important prevention, the prevention is done which is given by our honorable prime minister, that is maintaining social distancing. Social distancing means maintaining 1 meter or 3 feet distance from each individual to prevent the cross infection. Next is maintaining proper hand hygiene. Proper hand hygiene means hand wash with the help of alcohol based solution or soap and water for 20 seconds to prevent the cross infection, and which kills the viruses present on. Avoid touching nose, eyes, and mouth regularly, where it may lead to the increase the infection in our body. Maintaining proper diet, nutrition, and exercise daily. Avoid smoking, where it can increase the risk of infection COVID-19. If any major symptoms is seen, seek to the medical care and medical treatment for individual. Avoiding going in mob and crowd places. Wearing a mask with a proper precaution should be taken while wearing mask. If it is wet, not using it regularly. Changing the mask and discard it properly. Everyone is saying that if I am suffering with COVID-19, why should I be isolated or why should I get quarantine? There is a lot of difference in isolation and quarantine. Isolation is given for the 7 days and quarantine is given for the 14 days. Isolation means the person or the individual is already sick and told to be isolated from other people, not to get infected to other peoples, or not to mix with other people, that other people can get infected because of one person. That is isolation. And what is quarantine? Quarantine means the person or the individual is not ill or not sick, but told to be isolated from the crowd to prevent own self to get infected because of any infection. Stay home, be safe. Thank you.